Can folks see my screen okay? Presenters, can you just give me a heads up or a thumbs up if it's good? Perfect. Alrighty. So while we're giving people a few additional minutes to get logged in, get their audio connected, I'm just gonna run through some quick housekeeping notes. First and foremost, if you need any captioning, the captioning has been enabled for this session. It's typically a CC button and it's usually on the bottom in Zoom, sometimes the top. So if you need to turn captions on, definitely feel free to do so. Also, this session is being recorded. So if for some reason you need to hop off early, you can always go back and check out the recording at a later date. It will be posted to the website, same place where you found registration for this session. So definitely feel free to check out the recording if you have to jump off for some reason, or if you want to share with others. It's, again, completely free. We would love to have more people check these out. We have several other recordings from previous sessions that we did focused on information technology, manufacturing, and construction. So definitely check those out as well. They're also on the website. Additionally, the slides for today's session, they have been posted on the website. I believe Jen has already popped a link directly to the slides in the chat. So you can feel free to follow along with us. Feel free to download those and share them with others if you are interested in doing so. We're happy to share resources and things like that. And then I think just kind of last note for the group, we do have a few questions that came in with registration. We will get to those at the end of the session. So we will touch base on those questions that we've already received. But if there are any additional questions from the group, we would love to hear from you. You can feel free to put your questions into the Q&A box. And you can add those in at any time. We'll answer any questions at the end, but feel free to pop them into the Q&A box when they occur to you, and we will get to those at the end. And then I think the only other thing is just feel free to chime in the chat if you want to communicate with one another, or if you're having any difficulties with tech, or if you have any questions just about, slides, recordings, things like that. So without further ado, I think we will jump right in. So again, if you are here for workplace accommodations in healthcare, attract and retain a quality workforce, you are in the right spot. And we want to thank you again for joining us. Before we get into our content today, we want to introduce our wonderful presentation team. So I'll go first. My name is Beth Gertner. I'm the Director of Education at the Stout Vocational Rehabilitation Institute. And I'm turning it over to Brianne.
I'm Brianne Warner. I'm the Assistive Technology Specialist here at SVRI.
Hi, everybody. I'm Lynn Hardzinski. I am the Business Services Consultant for Northeast Wisconsin, which includes Green Bay, Sheboygan, Manitowoc, Door County, and all the way up to the Upper Peninsula.
Good morning, everyone. I'm Chrissy Nyrink. I'm a licensed professional counselor working for the state of Wisconsin as a vocational rehabilitation counselor.
So as you will probably have noticed based on our different presenter backgrounds and our quick introductions, we are tag teaming this from two different organizations within Wisconsin. So I will let Chrissy talk a little bit about Wisconsin DVR.
Thank you, Beth. So the Division of Vocational Rehabilitation, DVR, is a federal and state program designed to obtain, maintain, and advance employment for people with disabilities by working with DVR consumers, employers, and other partners. We serve individuals with disabilities who face a substantial barrier to employment by providing employment services and counseling to our consumers. We also assist in providing a range of services to enable one's ability to work, along with providing training and technical assistance to employers regarding disability employment issues. DVR is located as a partner in 22 job center hubs with 19 additional service locations throughout Wisconsin. DVR staff can provide services in most locations throughout the state using remote access technology.
Thanks, Chrissy. And as mentioned earlier, Brianne and I are at the Stout Vocational Rehabilitation Institute, or SVRI. And we are actually housed underneath the umbrella of University of Wisconsin Stout. So we're an institute that kind of has a three-pronged approach to what we provide. We provide services to individuals with disabilities. We also are involved in several different research projects. And then we do various education programs and training programs, kind of like this one you were at today. So that's kind of our approach. So we're more of a support organization for wonderful folks like Wisconsin DVR. So before we get too much into our content today, just want to talk a little bit about quick acknowledgement and disclaimer. So this partnership between Wisconsin DVR and SVRI, this is all being brought to you under a grant project. So just want to do the quick disclaimer that our contents and our opinions aren't necessarily representative of the Department of Ed or the federal government. So our objectives for our time together today, we're going to start pretty broad and do some definitions, just make sure that we're all on the same page when it comes to terms like disability, universal design, accommodation. I know that we definitely have some folks who are attending today who are very well versed in these areas, and we might have some who are less so. So we just want to make sure we're all kind of working from the same definitions. And then we want to talk to the benefits of hiring individuals with disabilities, particularly when we're talking about those diversity, equity, and inclusion initiatives that a lot of businesses have been launching in the past few years. We'll also talk about universal design and accommodations, and specifically how those impact folks who are in the healthcare field. We'll share some success stories, and then we'll wrap up learning about the business services team in Wisconsin and how you can connect with them. All right, so we're going to start today, as I mentioned, with those baseline definitions. Again, I know this might be old news for some folks, but we're going to use the definition that is in the Americans with Disabilities Act. So I think it's just helpful when we're talking about employment to kind of go with the ADA definition, can be very helpful. But just want to note that in other contexts, you may see disability defined slightly differently, kind of depending on the situation. So I've broken down the definition into three different parts. That first part is a physical or mental impairment. If I asked everyone here today to say the first thing that pops into your head when somebody says the word disability, or you think of the word disability, there probably are going to be some differences and also some common themes that are going to emerge. Some folks might think of the international symbol of access, so that symbol that you'll see on handicapped parking spaces, or that you'll see on those buttons to remotely open doors, things like that. Some folks might think about their own personal experience with disability, whether it be they themselves, or whether it might be someone in their family or circle of friends. Some people might think more so of disabilities that are really visible. So, somebody using a white cane to aid in their mobility, or somebody who is experiencing some sort of physical disability that is very visible and can be seen by those interacting with them. But regardless of what your first thought is when somebody mentions the word disability, or you're thinking about disability, I think it's really important that we push ourselves to go beyond that first thought. Remember that disability is a very, very broad thing. It's physical or mental impairments. So that means we're talking about disabilities that are both visible and invisible. So just because we don't see something doesn't mean that it isn't a really big part of someone's life and someone's experience. And then part two, substantially limiting. So you'll notice that's very broad when it comes to, the language used there. And that's done intentionally. The ADA is really meant to be inclusive in this definition. So something that's substantially limiting to one person may not be to someone else and vice versa. So an individual's resources, their personal experiences, their support system, where they live, all of those things can have a large impact on whether or not something is substantially limiting for them. And then the final part, part 3, that one or more major life activities. So again, more really broad language meant to include folks. So, those major life activities, they could include everything from, personal care tasks, those things that we need to do when we wake up in the morning and get ourselves ready for the day. Those hygiene things, things we do to get ourselves up and out the door. It could be our ability to sense the world around us. It could be, tasks that allow us to be successful both at school and at work and in social situations. It might even be, major bodily functions. So in terms of those major life activities, again, it could be many different things. And I just want to challenge everyone here to kind of push past your initial thought when you think about disability and you think about the definition of disability and think about things that might seem a little bit outside of your realm of experience. All right, so we're going to start off with just a very brief audience participation section. So we're going to do this a couple times throughout the session today. They're going to be launched in polls within Zoom. So this first one, it should have popped up in a separate window for you. And just real quick, want to poll the audience and hear how many adults in the US report having a disability. So just take your best guess, or maybe roughly how many people in the US adults do you think are reporting that they have a disability? So we'll just give folks another quick minute to answer the question. And we will have these polls that pop up a couple more times throughout. So stay tuned, keep your fingers close to your mouse and keyboard so that you can join us. All right, looks like we have most folks. So I'm just gonna end the poll and share the results. All right, so looking at this poll here, it looks like majority of folks on the call today did get the answer correct. So the correct answer is 27%. So 27% of adults in the US report having a disability. And that statistic comes from the CDC. So we're looking at roughly a quarter or a little more than the population. So I think is really important when we kind of talk about why we're here and why we think this is so important to talk about disability and employment and how these things go hand in hand. All right, so I'm gonna stop sharing that poll. So, why does this matter? Why is it important for us to talk about disability, on a societal level, a professional level, even a personal level? So if in the United States, we're seeing about 27% or roughly 1 in 4 folks reporting that they have some type of disability, this statistic is really just illustrating how prevalent disability is in the US, whether we realize it or not. Again, as I mentioned earlier, sometimes when we think of disability, we tend to think of the most visible disabilities. But the reality is that there are many folks out there who identify as part of the disability community. And it might not be something that they share a lot. It might not be something that's obvious to those who interact with them regularly, but that doesn't mean that it's not a huge part of their life and a huge part of their experience. And it also illustrates the statistic, the likelihood of us knowing and interacting with folks with disabilities. So whether we know it or not, there are people in our lives, in our social lives, our professional lives, who have disabilities. That's part of their experience. So even if we don't realize that a coworker has a disability, that doesn't mean that they haven't already found some wonderful accommodations and things to help them be really successful at work. So I think it's really important for us to kind of highlight this and realize that with a statistic this large, we're really looking at disability impacting all groups of people, regardless of their age, their gender, race, socioeconomic status, or geographic location. And if you want to look more into some of these statistics, if you click on the link to the slides that Jen put into the chat, on this slide, that CDC infographic, that will actually link you directly to the CDC website. And there are some additional statistics and kind of a snapshot infographic that I think is really helpful and is a pretty nice tool to take a look at. One other thing I want to note when we're talking about the prevalence of disability and why this is important when we're talking about employment. So if we have the benefit of growing older, the odds that we ourselves will experience disability is going to increase. So whether that be through illness or injury, the longer we're on this earth, the more likely something is going to come into our lives that may impact our ability to engage in those major life activities, something that we may find substantially limiting. So folks with disabilities are already a vital part of our workforce. And as the US population continues to age, we really want to engage with folks and make sure that needs are being met and that we are being as inclusive as possible and recognizing the strengths and the talents of this group of people. So we've talked about how we define disability, we've talked about prevalence, we've talked about harnessing the potential of this group and that folks with disabilities are already out in the labor force and already doing wonderful work. So now I think it's important to talk about where things kind of currently stand in terms of labor force participation. So the statistics on this slide are coming from the Department of Labor website. And these are actually from January of this year. They probably have a new updated set. The Department of Labor is very on top of these things. So if you ever want to check it out, again, that disability and the labor force, kind of the title for this slide, links directly to the Department of Labor website. So if you want to check out more. But as you can see on this graph here, the dark blue bars on the left-hand side, those represent persons with a disability, whereas the light blue bars on the right side represent persons without a disability. So you'll see in that first bar comparison, when we're looking at labor force participation rates for those who are 16 and older, they're significantly higher for folks without a disability than for folks with a disability. And then when you look, unsurprisingly, at the employment rate, that next bar over, the unemployment rate is going to be higher for individuals with disabilities than those without. So really, kind of VR's goal here is to help lessen the gap between these bars, to help increase that labor force participation rate for persons with disabilities and help decrease their unemployment. So really, we're hoping to kind of lessen the gap, reach out more to employers, support individuals with disabilities as they look towards their employment goals. So for folks who are currently working, lessening this gap between these bars really means a more diverse workforce that's welcoming and is highlighting different perspectives. It's utilizing different skills and pools of talent. For employers, lessening this gap between these two groups can mean having people on your team who understand some of those unique experiences of living with a disability, which can in turn lead to the creation of products and services that are appealing to a larger group. So you're going to have products that have designs with people with disabilities in mind. That makes them more accessible for a larger group of people. Same thing with services. So it definitely is a benefit to employers as well. And with that, I'm going to turn things over to Chrissy, who's going to talk about some common myths and some more benefits of hiring individuals with disabilities.
Thank you, Beth. As Beth shared, the word disability looks different for everyone. There's a wealth of knowledge, of talent that awaits employers who are open to opening those doors to candidates with disabilities, and effective job accommodations are key to hiring and retaining them. So when one thinks of hiring a candidate with a known disability, some may overlook the candidate's potential and focus more on the common myths many of us may assume when we hear the word disability. Not everyone with a disability needs an accommodation. Accommodations vary, just as people's strengths, work environments, and job duties vary. Accommodations can be at little to no cost to employers. Some examples can be a modified work schedule, noise canceling headphones, and Brianne and Lynn are also going to go a little bit more in depth of accommodations as well. And you can go to the next slide, Beth. All right. So there has been some research that has been done. Lynn is going to go into the Job Accommodation Network website. So that'll be coming a little bit later in this presentation. But based on some research that has been conducted from the Job Accommodation Network, surveyed employers report they want to provide accommodations so they can retain valued and qualified employees. Employers also noted that making workplace accommodations far outweigh their associated costs. From this survey, employers, and I'm sorry, Beth, I did have you jump ahead. Sorry about that. From this survey, employers reported multiple direct and indirect benefits after making accommodations such as reduced insurance and training costs. By providing a reasonable accommodation, employers reported increased productivity and morale, as well as improving the company's diversity. So many employees with disabilities are skilled problem solvers by virtue, as they've had to manage a disability daily in a world that wasn't designed for them. All right, now we can go to the next slide. So there's been some evidence-based research that has been conducted over time exploring the different kinds of strengths and abilities one can bring to an employer. This slide just kind of talks just on a couple of them. Somebody that may be on the autism spectrum, they can possess higher than average abilities in many skilled areas. Some examples of higher abilities may be creativity, the focus, the memory. Those on the spectrum can also possess increased efficiency and personal qualities such as honesty and dedication, exceptional attention to detail, and also tolerance with repetitive tasks. If we're looking at somebody with developmental disabilities, though someone with a developmental disability can be more productive, they may have fewer absences. They're very loyal to their employers. And they also tend to love learning, appreciate the beauty and excellence of a finished product, and are naturally very kind. Looking more so at mental health, somebody that might be having a mental health condition, they can feel that work gives them a sense of purpose and belonging. Other characteristics can include having great empathy, creativity, realism, as well as resilience. So mental health awareness, as we know, is out in the world. I'm happy to see that I feel it's coming a long way, is becoming less stigmatized. However, when it comes to employment, it can still be a challenge for many to feel that they're supported and successful in their job. So right after the pandemic, the US Surgeon General released a framework to the public regarding mental health and well-being in the workplace. This was released in the fall of 2022, and there is a link at the end of our presentation where you can actually go out and look at this online. This framework can be located on the US Department of Health and Human Services website or doing a simple Google search. So during the pandemic, many of you have probably heard or experienced the term the Great Resignation or the silent quitting, as it highlights how the pandemic has really shifted the way that Americans live and work. In a recent study conducted by the American Psychological Association on the work and well-being, nearly 2 in 5, so 39% of workers report that their work environment has had a negative impact on their mental health. This framework from the US Surgeon General has been centered on the worker voice and equity in the workplace, as it outlines how long working hours, limited autonomy, low wages aren't just driving the US shortage of workers, but it may actually be at the heart of the nation's mental health crisis. So looking at the framework, it highlights 5 essential areas for workers in organizations and businesses of every size to help leaders develop policies and practices that support the mental health and the well-being of the workers. I wanted to share this framework as it can be very beneficial for employers to rethink and how they protect workers from harm, fostering a sense of framework or fostering a sense of connection among workers, show workers that they matter, make space for their lives outside of work, and support employees' growth. By putting mental health at the center of the workplace policies is more important now than ever before as the nation continues to face a lot of financial stressors, shifts in the workplace culture, as well as growing concerns about the stress among Americans. Millions of people are a part of the workforce today, and the average full-time employee spends approximately half of their waking life at work. It's no longer enough just to acknowledge that mental health challenges are in the workplace. Now there's this framework, if you explore into it a little bit more, that can help really look at those 5 essential human needs that we need for a mentally strong and a resilient workplace. So in the spring of 2021, DVR received a grant from the US Department of Education called Career Pathways Advancement. The initiative of this grant was geared towards increasing the percentage of consumers that we work with in DVR advance into one of the 4 STEM areas, which are construction, healthcare, information and digital technology, as well as manufacturing. Those are the 4 STEM areas that there's projected to be significant worker shortages. So this career pathways came in and it helps shift the narrative from helping our consumers to get and keep jobs and instead focuses on improving longer term employment outcomes consistent with the quality indicators. So another way to think about it is that helping individuals identify, pursue, and successfully achieve career goals in high demand occupations with opportunities for growth is an investment in their future economic well-being. The grant is also geared for employers as it embraces the dual customer approach of focusing on retaining workers and the endless opportunities that that brings. So another initiative to help job seekers gain the necessary skills to help employers find qualified applicants is our apprenticeship programs. Many of you may have heard about them before. An apprenticeship is an earn while you learn program, which provides a lot of on-the-job training and related instruction. So the employer teaches the skills of the occupation. Areas like the technical college or private training centers teach the theoretical knowledge pertaining to that specific occupation. You can also explore more about Wisconsin apprenticeships by visiting any job center or online through the Job Center of Wisconsin's website. So now I will turn it over to Brianne as she will talk about universal design.
Thanks, Chrissy. So we'll just cover the basic universal design. It is the design and composition of any environment so that it can be accessed, understood, and used by all people, regardless of age, size, ability, or disability. It is the design of products, excuse me, environments and buildings to be aesthetic and usable by everyone. The application of universal design products minimizes the use of assistive technology, resulting in products compatible with assistive technology, and it makes products more usable by everyone, not just those with disabilities. This also needs to put into account and consider economics, engineering, culture, gender, and environmental concerns. If universal design is designed well with accessibility and usability in mind, everyone will benefit. So how does universal design fit into healthcare? So universal design can be applied to every engineering plan to ensure that those who may be tall, shorter, deaf or hard of hearing, blind or low vision, or those who may have mental or physical disabilities can all have access to the same resources. There's patients and employers, employees from all aspects of life. So facilities need to be able to be accessible for everyone. These considerations include space, cleanliness, accessibility, security, security, and environmentally friendly. Space means, just the size of space for medical facilities. So space and size for the clinics and hospitals, maybe 4 different offices. Cleanliness, making sure that sanitation is there. Hospitals, clinics, and medical offices have everything in place, procedures that they follow. Accessibility, how individuals, ambulances, helicopters, wheelchairs, gurneys, people on crutches, or anything else that you think of mobility-wise, how they're able to access a building, in getting into the building and within the facility itself. This must ensure that ramps, elevators, and ambulance bays are also in place. Security is just kind of how it sounds, making sure there's adequate security throughout all facilities and buildings. And then being environmentally friendly, making sure that, many hospitals, facilities, clinics, they use a large amount of, have waste and a large amount of energy. So using environmentally friendly products is key. Next slide. Pass it to Lynn.
All right, thanks, Brianne. According to the slide, as you can see, I'm going to define what an accommodation is, and it's any change to the work environment or the job that makes or allows the person with a disability to be successful or enjoy equal employment opportunities that includes promotions, raises, and recognition. The caveat is that the employee must be qualified, so it must meet they must meet the minimum skill level and be able to do all the essential functions of the job. And through an interactive dialogue between the employer and the employee, they'll discuss with each other what is going to work best. And in 2022, here in Wisconsin, there were 2,140 disability-related claims. And of those, 517 were due to an employer who failed to provide a reasonable accommodation. So that's almost 25%. A request for an accommodation can be verbal, written, or implied. There's no required language that must be used. It can be long-term or short-term. It can be temporary or permanent. And it can be requested by the qualified employee at any time. So it can be when they're applying for the job, during the hiring process, when they show up for that the first day for the new job, or after they've worked in that position for months or even years. And that's because, as Beth had mentioned earlier, a lot of us can acquire disability through aging or accidents or things of that nature. So the employee can suggest what a reasonable accommodation would work, but ultimately it is the employer's choice. And what is going to be established is based on the following things. First of all, it has to be effective. The employer and employee may go through several modifications before they both settle on what works best. It can only reduce employment-related barriers. So we want to make sure that you're looking only at the work site, not at any issues that happen at home. It must not cause undue hardship for the employer. Typically, we think of undue hardship as something as being costly, but it could be something else. Undue hardship is going to vary by company. Installing an elevator might be out of the budget of a small company, but probably not an issue for a large corporation. Excuse me. It must not reduce or eliminate essential functions. So the employee still needs to be able to do what those essential functions are, with or without that reasonable accommodation. And it must not reduce production standards. So if everybody's required to produce 10 widgets in an hour, so must the employee who has a disability. And ultimately, it is the employer's choice. So next slide, please. All right, we're gonna have a poll real quick or just go ahead and type in what kind of accommodations you have already seen in your workplace or even out in the community. And I believe you can do multiple answers in the text box. So we'll give you a minute to do that.
Yes, you will only be able to submit once, but feel free to throw multiple examples in your single submission. There's a character limit, but I think it's relatively large.
And then while we're waiting for those, are we gonna see those?
Yes, yep,
Okay.
we have about 12 responses in right now, so I'm just gonna give people another moment here.
All right, awesome.
Great, I will share the responses here.
All right. That's very tiny.
Sorry.
That could just be me.
Do you want me to read them out, Lynn?
I can put on my glasses, that's fine. Chairs to sit on, reducing hours, breaks, or a stand sit desk, or stations, absolutely working from home, alternative work schedules, full-time or part-time, assistive technology, remote work, or on site, another sit stand desk. Work scheduling and seating, task lists, visual aids, timers, a job coach. That's a wonderful example right there. Sitting stand, low lighting or specialized lighting, adaptive equipment, technology accommodations, stools, extra breaks, ergonomic devices, assistive technology, move the desk away from the copy machine. Yeah, I would want that as well. Adjusted schedule, screen readers, ergonomic chairs, keyboards, mouse, a anti-fatigue mat, breaking down into smaller breaks, breaking files into smaller files. So kind of compartmentalizing a job a little bit or a task. And page 2, a sit stand desk. So yeah, lots of things you've seen in work already. Some other obvious ones, the curb cuts that you see, automatic doors and ramps and parking, even maybe raised toilet seats in the restroom at the company. Maybe adding for various senses, somebody mentioned the lighting, but what about maybe an ASL interpreter or TTY machines, relay services, captioning, magnifiers, large print, having a fragrance-free workplace or allergen-free, having an air purifier, I see color coding and templates that somebody just put into the chat. Absolutely. Those are some great ones. Fidget devices are really good, especially for mental health. Flow charts and the checklist that somebody had mentioned, even a support animal or allowing someone a quiet space, which was mentioned earlier. So even eliminating the non-essential functions. So great job. Lots of good ones. So next slide.
So now we'll talk about how assistive technology fits into healthcare. Assistive technology is vital to enable people to live healthy, independent lives. It lessens the burden of long-term healthcare, enables people access to access education, remain in the workforce, and be active in society. Assistive technology devices exist to improve an individual's quality of life. This helps to reduce the burden of certain health issues such as mobility, low levels of sight or hearing, possibly amputations, speech difficulties, and more. It reduces the need for healthcare services. So this lessens the burden on healthcare systems as well. AT can support individuals enough to not have to require a caregiver when they might otherwise need one. And then it allows people to live full, healthy, happy lives. Next slide. How does assistive technology differ from medical devices? So a medical device can be any instrument, apparatus, implement, machine, appliance, software, material, other similar items that are intended to be used alone or in combination for a medical purpose. So assistive technology is any item, piece of equipment, or system that can be acquired commercially. It can be modified. You can customize it yourself. It's used to increase, maintain, or improve functional capabilities of individuals with disabilities. So assistive technology does fall under the umbrella of medical devices, but not all medical devices are assistive technology, if that makes sense. This could be, if computers have programs, software programs, but they don't include a screen reading software, then that's not an assistive technology device. Next slide. So you guys listed some great examples of assistive technology devices, software programs, and Lynn talked about a few others. These are just more specifics, I would say, as far as healthcare goes. So accessible telephones throughout the facility that you might be working at. These are for low vision or vision loss. They can have larger buttons. They have screens that have captioning on them. Also used for hard of hearing as well. Adjustable exam rooms, or exam tables, excuse me. Amplified stethoscopes. Bath chairs. This could be for the employer or employee, just helping, if you have mobility, back issues, something, so you're not having to bend over to help, or if you, helps with transfers as well. Blood pressure monitors, these could be digital. Wearing clear face masks for those who are deaf or hard of hearing, that way they can lip read. Certain grip aids, lifts and carriers for mobility aids, easy reaches, Hoyer lifts. That way it decreases the amount that you are physically using your body to help lift somebody. One-handed syringes, talking monitors. This could be like a blood glucose monitor or a blood pressure monitor. They also have talking thermometers, talking calculators, anything that you might need. Vein finders, and then hearing aids. And I will pass it back to Lynn.
There we go. This is just some examples of what you could find as a reasonable accommodation, in addition to what Brianne had said. For individuals who have latex allergies, there are protective gloves that don't contain latex. They might be rubber or vinyl. High contrast keyboard stickers for the keyboards. This was something that we also mentioned for our accommodations in IT. So you'll see there's a lot of overlap for a lot of these different industries. Somebody else who might have sensitivity to smells or allergens, a disinfectant spray that doesn't have any harsh chemicals, which is just good sense for the environment anyway, and air purifiers that have allergen control on them. So next slide, please. Okay, I'm going to tell you about some of our success stories that we've had here in DVR. So first of all, I want to talk about Megan. She came to DVR in October of 2018, and she had limitations in her mobility, work tolerance, and work skills. And the disability, I can't even pronounce it, but it's an extreme and chronic pain that she experienced in her feet. So initially, her IPE was developed with the goal of being a court reporter. But then as she went to school, she found that this was not going to be a good match for her. So then she went and she was able to get a temporary work experience that allowed her to develop computer skills and clerical skills. And she completed this temporary work experience as a front desk clerical position at a dental office. And then she also achieved the Microsoft Office certificate program at a local tech school to improve and advance her computer skills. She found that it was difficult to recall and retain information related to the software system that the dental office used, and to process the dental lingo quickly, and taking sufficient notes while she was on the phone. And also had some difficulty resuming tasks after she was interrupted. Fortunately, this was a great employer who noted that she was friendly, did learn quickly and showed interest in learning more, followed instructions, and got along well with other staff. So they worked with her to create a position of that involved her working one-on-one with customers as a better fit. And so she did try this out with another temporary work experience. And eventually she was hired at when she had completed that. So the DVR services that were provided were vocational counseling and guidance. We took advantage of our training grants to pay for education. She did participate in job shadows, job development, a temporary work experience. She had retention supports and also supportive shoes, and did receive some mileage reimbursement, which is a nice little thing. Okay, so Lee, in March of 2023, Lee was working at a school and a school district, and lost her job. She struggled with initiating tasks independently and interacting with the kids. There were 6 students in the classroom, and Lee was only able to work with one effectively at a time due to her personal limitations. So DVR provided interpersonal skills training. These were necessary to address her limited ability to interpret and respond to social and emotional information in real time. She had limited problem-solving skills, and her need for sensory and cognitively based treatments was important in order for her to self-regulate herself. And then in May of 2023, so only 2 months later, she accepted a job as a unit assistant at a senior community. Once there, she participated in systemic instruction services to help her learn job tasks, communicate effectively, and seek help when needed, and to help her develop natural supports. The accommodations provided by the employer were allowing a job coach on site, presenting Lee with a task list, and offering her extra time to complete those tasks. She proved to learn her role more quickly than expected, so she only needed the systematic instruction for a month, as opposed to what usually is a 3-month support. And eventually, her DVR support became more hands-off, and her job retention services we eliminated the job coaching. And by January 2024, she's proven herself so valuable that she's picked up one more day of work per week, and her case was closed successfully. John, this is a shorter case, but he had sensory neural hearing loss, and that affected his interpersonal skills and communication. He struggled with expressing, processing, and receiving information for his work-related activities as a chiropractor. So DVR assisted John in purchasing hearing aids, which helped improve his interpersonal and communication with his customers, and to continue his employment as a full-time chiropractor at his own business. So next slide, please. So the business services consultants here at DVR are statewide, and what we do basically is to connect employers to a larger integrated business services team. So we help employers solve their challenges in hiring and retaining qualified employees. So at no cost, we offer our services. We help them understand the benefits of hiring people with disabilities. We also will help them create a workplace culture that understands and accepts people with disabilities. So some of the services are the recruitment assistance, matching candidates to business needs upon request, and connecting employers to our larger and integrated business services team. We help inform them of other resources that can help them in creating this workplace culture. And this dual approach that was mentioned earlier, of the employers are one customer and our job seekers or consumers are the other customer. We want to make sure that we speak the language of the employer and not our jargon. I use, acronyms all the time that you may or may not understand, but we want to make sure that we talk to the language of the employer and their terminology so we can better connect with them and build trust. The BSCs statewide are certified windmills trainers, and this is a disability inclusion program to help an employer who is looking to change the perception of ability in their workplace. And we offer this free of charge to an employer upon request. We are part of the larger team, like I had mentioned, and the other members of our statewide business team include such agencies and partners who are also working with job seekers. So it might be the Office of Veteran Employment Services, the Department of Corrections, Community Corrections Employment Program. We partner with the Job Service and Job Centers, apprenticeship, both the registered apprenticeship and youth, the Workforce Development Board, Job Corps, or even the Senior Community Services Employment Program. Next slide, please. So one thing to keep in mind is that when we work with employers, there are no cookie cutter approaches when we reach out to them. Each relationship is unique, and this uniqueness is how we can build these trusting relationships, because what works with one employer may not work for another. So we might reach out in virtually or in person, email, or by phone. We might follow up with somebody that we've met at a local job fair. So when we meet with these employers, we want to look at that company culture and see what that's like. What does it feel like? Is this something that's family oriented? Because maybe it's family owned. Maybe this is an employer that's already inclusive and is already familiar with DVR and working with people with disabilities. This might be a company that's minority owned. So we're going to ask about that. And we really listen to what they have to say. We want them talking most of the time because they're the ones that have the issues, and we can't learn about them if we do all the talking. So we'll work with them to strategize a plan that meets their needs and share supports and resources that can assist a business with attracting, retaining employees with disabilities, maintaining their performance and productivity, and make sure that they are engaged. So when we're there, as we're finding this information, we're going to ask for a tour. We want to see what the job looks like actually being completed by somebody who is working that position. No matter what the job description says, there are so many things and nuances about a job that just aren't written down or can't be. I mean, maybe you can't just write every little tiny thing down that somebody might do during a job. So this tour is important to see what does it really look like? What is the employee doing? I'll look at things like movement, raising arms, twisting, and that sort of thing. And I'm looking in terms of what might a reasonable accommodation be. If the employee is a federal contractor, I'm going to ask if they know if they've reached that 7% number of hiring people with disabilities that the Office of Federal Employment requires them to have. And I don't do this because I want to tattletale to the feds. That's not what my job is all about. I see this as an opportunity to diversify their workforce and really get in there and talk to them about employing people with disabilities. I've had employers ask me about their wages, especially when they have trouble attracting talent. Is their is what they're offering similar to other companies in the area who have the same position. So I'm going to look at our labor market information for the area for that industry. And labor market information tells us what our current economic reality is. It's data about the labor market, the supply and demand, earnings, job growth and job outlook, and various demographics in the labor force. Our services are directed to the employer needs, whether that's retention and hiring, or maybe they're not getting traffic to their website to apply. Maybe they get the traction to the website, but people are reading it and moving on. So we might want to look at that job description. Are they saying that somebody must lift 50 pounds? That can be a problem, and that might inadvertently discriminate against people with disabilities or anybody really in general, because the function is not to lift something. The actual function is to move an object from point A to point B. So we'll work with them to kind of revisit that and maybe reword it somehow. They may need to look internally to see, they may claim they're, supporting DE&I, but are they really? So we want to look and see how they might be supporting that to make it a welcoming place. Our knowledge base is available for any employer to tap into as far as accessibility, creating accommodations, dispelling myths and stereotypes and other misperceptions, and again, to provide that windmills training free of charge if they are looking to diversify their workforce and make their employees and managers, supervisors, and the owner of the company be more disability aware. So next slide. And we're going to launch another poll. And just curious if you have already connected with the business services consultant in your area. We'll give you a minute to answer that.
Lynn, while people are answering, I know this is a question that came up when we've done these sessions previously for folks in different states. Do you have any recommendations for them, like how they should connect with business services in their state if they happen to not be in Wisconsin?
I sure do. You can go to any state's website, their government website, or you can Google Voc Rehab Services in, say, Minnesota or whatever state you're in. And you're going to find, it might be called Division of Vocational Rehab. It might be Rehabilitation Services. It might have a different name than what we're using. And instead of a business services consultant, it might be employment specialist or employer outreach specialist or something like that. The names might be different, but the job is going to be very similar. So just a little Googling on the state's official website should bring you there. Awesome. I see a lot of yeses. So that's excellent. I'm glad to hear that. Next slide, please. And for those of you that haven't connected with us yet and you are interested in connecting with us, you see on your screen a map of all of the business services consultants statewide and where they're located. And you'll see it's color-coded. I'm the dark green that covers Door County there on the northeast side of Wisconsin. And you can click on the that is an active link where it says DVR Business Services Consultant Contact. So you can click on that on the PowerPoint. Next slide, please. All right. We have some great resources for you. DWD has the accommodation training library that you can check out, but the one that I really want to show you is the Job Accommodation Network. So Beth, if you can click on that, please. I'm going to just give you an example on what you can do to go to this website. Excuse me. So as you can see across the top, there's a section in that dark blue band for employers, individuals, their ADA library, A to Z lists, accommodations search, and various publications. And they do have training on their site that you can take. But I'm going to have Beth click on A to Z lists. And you're going to see there's little tabs there. You can search by disability. You can search by limitation. You can search by work-related function, by topic, and by accommodation. And if you would just scroll down a little bit, I'm going to have you, it's alphabetical by columns. I'm going to have you find attention deficit / hyperactivity disorder, and go ahead and click on that. And then what you're going to see here is a little information about the disorder itself. And if you scroll down some more, how it connects with the ADA and things to consider when you are accommodating somebody who has ADA, a little paragraph, and then some questions to think about as this interactive dialogue happens between employee and employer. Some key accommodations to think about, and so focus, concentration, time management, and various ideas to get you thinking. But then under by limitation, Beth, I'm going to have you click on attention / concentration. So if you click on that. So now we have a list of products and ideas to help an employer come up with what's going to work best for somebody who has ADHD while they're talking with the employee. So if you click on applications, the second one down, please. There's a lot of great apps that can be on a phone or any kind of device that the employer might have where they can load this to. And I'm going to have you click on under assistive wear. If you click on the second one, Prolo for Text. So this is something that can be purchased by an employer. And what this is it's a speak up text with text-based ACC, which means augmentative and alternative communication app. So what this does is it helps an individual who has difficulty speaking say what they need to say. And this is appropriate for children, teens, and adults who don't always speak or can't speak, to allow them to be heard. So just one example. And on this particular any website where you click to find something to accommodate an employee, is going to tell you how to order it, other products they have, and you can see there it says support and resources, and then how much that's going to cost. Also, keep in mind that some other good things which cost nothing, and you can click out of this then, task separation or a flow chart, allowing a job coach. And a job coach is something that is supported by DVR, which is another reason why I encourage employers to hire people who are from DVR to get this job coach. A support animal, disability awareness training, which I had mentioned we offer, and that is available at no cost. And mentoring is also very helpful as well. So next slide, please. Some other resources that you might want to check out. And these are all active links in the PowerPoint. And at the bottom, the ada.gov has a lot of resources regarding medical care and mobility, which can help not only the employee who has a disability to be accommodated, but as you know, working in a healthcare setting, you're going to have a lot of customers or clients coming in who need accommodations as well. So that's a good resource for that. Okay, next slide.
All right. So we just want to thank everyone for coming. As you can see, we're going to leave this slide up just for a minute in case you want to reach out to any of us to get more information. Say you want to connect with a BSC. Lynn's email address is on the screen there. You can reach out to her. Also, as I mentioned at the beginning of the session, these slides are available. They're posted on the website, so you can feel free to grab those, download them, and then you'll have access to all of those links that we've mentioned throughout our presentation, and also have access to our contact information as well. We did have a couple of folks who, when they registered, had a couple of questions for our group, so I want to get to those. While we're answering those questions, if anybody on the live call today would like to chime in either the Q&A or the chat with questions they might have, we would love to hear from you. And then also, once we've kind of talked through a couple of questions, I will have an eval that again is going to be launched in the same way through that same pop-up poll. We just want to learn a little bit more about where you guys are coming from and also kind of your thoughts about our topic today in our presentation. So we would love if you would stick around for that eval. It's only 7 questions. It'll take like 5 minutes tops. So with that, I'm going to stop share and then kick it over to some of the questions that we had that came in when folks were registering. Right, the first question that we had that came in was, are there protections in place for workers with disabilities that miss any amount of days due to disability during a probationary period? And I don't know if Lynn or Chrissy, you might have.
I can start. I would just say for that individual, they're going to need to disclose. I'm assuming it's a disability that requires them to have some days off of work. So one thing that they're going to want to do is disclose right away that they have a disability, and as their reasonable accommodation is, to have this extra time off. And part of that conversation can be, I can make up the time, or if it's part-time, instead of working on Monday, I have my doctor's appointment, maybe I can come in on Thursday. So that kind of flexible scheduling. They might, one thing I think to remember though is for something like this, I would wait till that job offer has been presented and the employee has accepted it. If they do it during the application process, it could mean that the employer may decide not to hire that person for that reason, which is discrimination. But unfortunately, it's on the burden. The burden is on the applicant to prove that they were discriminated against. Once they are an employee and they say they do need to have extra time off, the employer does have to grant a reasonable accommodation, and that's where that dialogue comes in to figure out what that's going to look like. But a lot of times for part-time work, offering that flexible schedule is probably the best way to go. Anyone else?
Thanks. Yeah, I don't know if anybody else has anything to add to that one. Yeah, I think Lynn, you're right that it really is just about having that open conversation once that, position has been accepted about limitations so that we can avoid that conflict coming up before we even get to that point. I think that probably would, yeah, I agree with that recommendation. We have a couple of other questions. Someone had asked, what are some approaches for partnering with healthcare HR departments that have been successful when it comes to kind of carving out positions for candidates?
I'm wondering, I guess the question is approaching healthcare who's already been working with people with disabilities. That's kind of what I'm gathering from the question. Is that kind of
Yeah, it looks like this question comes from Leah. So if Leah
Okay.
happens to be on right now, feel free to unmute yourself and clarify. But it sounds like in general, just approaches for partnering with healthcare HR departments when it comes to carving out those positions for somebody who's, yeah, maybe already employed, or, maybe there's already a relationship there.
Yeah, well, that's half the battle. If they're already hiring people with disabilities, I think, you're going to want to reach out to the HR person. If you don't know who it is, you can find out, go to LinkedIn, go to the company website, go to glassdoor.com, find out who that person is. A lot of times, once you have a name, or if you have the email format, so, lynn.harjinsky at dwd.wisconsin.gov, anybody who works for DWD, now you know the format, it's first name dot last name at whatever email. Reach out to your business services consultant. They may already have a relationship with somebody. We go to a lot of different networking events. We belong to chambers, and we're reaching out all the time to various industries, not just healthcare, but reaching out to people all the time. I hope that helps.
This is Leah. I can kind of clarify my question. I am a part of Project Search, and so we are based out of a hospital. So I am familiar with our HR reps at the hospital. But I guess what I run into often is I have an individual that I'm serving that could do the job description with reasonable accommodation, but the position's posted as full-time. And so then I, ask if they could, make it a part-time position, or if we could carve a position that does a lot of the same tasks, but, it's not that full-time scheduling. So, but I run into a lot where like, well, we just can't do that. We just can't make something full-time to part-time. Or I just wondering if there's a way to approach that conversation where you can kind of, I don't know, educate employers better on like how we could support their workforce more if there was more flexibility with being open to different types of position postings.
Well, one of the things I've suggested to employers is, what if we had two people and they shared that job? And some of them say, hey, I never thought of that. And some of them, oh, no, I can't do that. I think it's a matter of just really extolling the benefits of, what, this person can do this, this, and this, and these are the great things that they're going to do for you in this position. Just really elaborating what they can do and what they can do for the facility. But I do say, I've said this to a couple people, if somebody wants to constantly go into business ABC and it's been months or maybe a year and they still haven't broken that, that glass ceiling or whatever, gotten in there, I say, it's just time to cut your losses and move on. Because there's always going to be one or two employers that you will not be able to establish that bridge.
Leah, I would also add, I think, and Lynn and Chrissy talked a lot about the dual customer approach too, especially for, the business services team. So I would also recommend, like, if you feel like you're hitting a barrier with a particular employer and you have a relationship and it's, overall been a pretty good one, but there are some hurdles that are coming up. I would kind of challenge you as well to just be curious and try and learn as much as possible about that situation. It's entirely possible there might be systems in place that just aren't flexible, and that's outside of that HR person's control. Or perhaps like learning more about their process, learning more about them and what their needs are. During that conversation, there might be some other solution that presents itself. So I would say, definitely you're not always going to have like unfortunately there are going to be situations where it's just not going to work out. But I would definitely say thinking about the employer also as a customer can be really beneficial, and thinking about what their needs are and what they really need accomplished and what boxes they have to tick, because ultimately it needs to be something that's beneficial